Welcome everyone, and thank you for watching this lightning round session presented by EZDI as a part of 2021 ACDIS Online CDI Summer Retreat. Let's begin. My name is Robert Morris. I am from El Paso, Texas. I work at El Paso Children's Hospital, and I'm going to talk to you today about the impact of leveraging computer-assisted CDI at our El Paso Children's Hospital. Our agenda for today, we'll be talking about our facility. We'll talk a little bit about our CDI challenges, our partnership with EZDI, impact on KPIs, some testimonials, and then we'll have a brief summary session. Our facility here in El Paso is a 122-bed facility. We typically have about 4,000 annual discharges and about 22,000 annual ED visits. Our core values are as follows. We want a very healing environment. We promote a community of excellence and accountability from the top all the way down. We also require respect and dignity, and our facility wants nothing but transparency with everything we do. When we started this journey with CDI, we faced several challenges that we had to work through. We had some issues with our manual process. It was very slow and cumbersome. We ended up having to keep filing. We weren't able to save our coding data, our clinical indicators, anything like that. And EZDI certainly provides an opportunity and the programming to fix this process. We're able to save our coding documentation, and we're able to provide our clinical indicators at, a brief look. They're right there for where you get your codes. We also had poor performance tracking. EZDI was able to help us move from non-trackable, where we basically had, nothing on paper as far as who was accomplishing what, to be able to track individual folks and immediately be able to see that. We could do it on a day-by-day basis, on a case basis. EZDI has every option you need for that. We also had some poor metrics that we were working through. This program, EZDI, allows you to really dig deep in those diagnosis codes and to find, the specificity you're looking for to increase your case mix index and any other metrics you're looking to improve. We were also able to improve our reimbursement by having accurate DRGs, not only on the CDI side, but on the side of the coders as we would do some collaboration. EZDI provides solutions for all of these problems. It's web-based, you have zero downtime, and it just allows for any kind of option that you need. Some of our prior metrics that we were looking at, our case mix index in comparison to some surrounding hospitals in Texas was much lower than their standards. Typically, they were at about a 1.5. We were at 1.09. And this is something that the facility was really wanting to improve on. This not only improves reimbursement, but shows that actual care that the physicians are giving and the hard work that all the teams are providing. Some of our documentation challenges, we were doing manual tracking of queries. That was challenging, more filing, lost paperwork, all of that can happen. Trying to chase down the physicians, it was a real challenge to try and keep up with that. So what we ended up doing with EZDI, we're able to have query work list and even track the physicians. We can see a response time, we can see the frequency at which they're responding, and it goes directly into their message center, so there's no way for them to miss it once they're reviewing their email, their messages, that kind of thing. We are also able to automatically have queries suggested for us before even opening up the system. You open up the system, choose your patient, and it's giving you options from the different information that's provided in the record, and just immediate, kind of putting your mind where you need to think and where we need to focus for those different diagnoses, those queries, and get those answers. We were also able to incorporate real-time reporting and analytics. All of this was missing prior to EZDI. At the, click of a button, you can have any kind of, analytic, whether it's once again going back to productivity, whether it's going about percentages as far as physicians responding to your queries as far as different diagnoses, most popular diagnoses within the facility. It's all there, and you can have it, exported in different formats, what have you, but it's all there for you. And those challenges were met. When we're talking about an AI-powered partnership, you got to have the people, the process, and the technology. The people, you got to have the staff, which would be your CDI and coding team, an organizational structure that supports that, and the culture. As far as the process, we have to continue to follow and have our movement within the facility and where we're going be within the vision and goals. We have to continue with our training and revitalization. We have to have policies and procedures in place that allow for all of this to continue and to improve on a day-to-day basis. As far as technology, that's where EZDI comes in. Their systems, their tools, the augmented CDI process that it provides, and the data-driven decisions, those are all the reasons why we chose EZDI. It's cloud-based, you have no downtime, it's easy to use, it's user-friendly. Everything that the facility required is in place and is adjustable for your individual needs. And for optimal CDI, you're going to end up with accurate DRGs. You're going to have access to those dashboards and analytics, and you're going to have an intelligent worklist prioritization. Everybody within that team is going to know what they need to do and what the priority is. Some of the impacts on our KPIs. Our staff productivity, and I can speak for myself, has gone up over 50%. The amount of workload that I can complete within a day is it's incredible compared to doing the manual process. We've gone up from approximately 8.6 reviews daily to 13.6 daily. And if you look at this next portion of the slide, you can see all of the benchmarks that are there. Our facility was not meeting those. We are now meeting or improved upon every one of those and at or above the benchmarks. That includes the query rates as far as the positive responses, negative responses, queries, and the with no response and physician response rate. We're able to improve on every single one of those. Here's those numbers I was speaking of. Time to query, we have decreased by 50 to 70%. Time to manage a daily census has decreased 85 to 95%. Time spent on reporting has decreased 70 to 90%. Our physician agreement rate, and this is tremendous, has gone up 75 to 85%. And the response rate in general has gone up as high as 95%. As far as the impact on the business KPIs, our case mix index was improved. This was a very important part of bringing EZDI on and where the facility wanted to go. We've increased our case mix index by 5%. We've also increased our productivity, like I spoke before, at 50%. We've reduced denials as high as 20%. Some of the intangible benefits, EZDI, once again, it is a cloud software. It removes the downtime concern. This hasn't been an issue for the last year that we've been using this, and it's been in the process for our CDI. It's a single platform. It's very easy to collaborate with other CDI or other staff. We actually have our coders that collaborate with us when we have a mismatch, what have you. Very simple, very easy to contact and continue a conversation with them. Like I said, there is almost zero downtime, uninterrupted operations. You're able to, work as long as you want to work. Security, your PHI is completely safeguarded. The security is a very high priority with EZDI, and it's included in the program. Data access for insights, less than 15 minutes, almost a real time. We're able to make real-time decisions and change whatever processes we need to do, in a real-time basis. Some of the testimonials, And one that, that I spoke to earlier is, it's a super simple program to use. It's very easy to learn. My personal productivity has increased, above 50%. I'm very happy, and I'm just able to be a more productive co-worker and CDI specialist with the institution of this program. In summary, we had poor CMI and a manual workflow challenge. Those were all met. We were able to increase our case mix index, and we are now a web-based system on where we're able to save our work, and we're able to work with our coders in a much faster and more efficient manner. People and process and technology are the key. The technology EZDI has impacted every part of the function and business KPIs, and an AI-based technology improves the health of the organization. Thank you very much. My name again is Robert Morris. If you have any questions, please reach out to me. Thank you.